Hi, I'm Dr. Ethan Wilson, your daily guide to simple and smart health tips. As we grow older, taking care of our health becomes more important than ever. Many people believe that the more tests they take, the better they are protecting themselves. It sounds logical. More information should mean better health, right? But that's not always true. In fact, some medical tests, especially for seniors, can be unnecessary, misleading, or even harmful when done without a clear reason. Today, we're going to talk about 5 health tests that seniors should think twice about before getting them done. Let's start by understanding something very important. Medical tests are not harmless. Every test has a purpose, and when used correctly, they can save lives. But when used unnecessarily, they can lead to false alarms, stress, unnecessary treatments, and even physical risks. That's why doctors always recommend tests based on individual needs, symptoms, and medical history, not just age alone. The first test you should think twice about is routine full-body CT scans without any symptoms. Many people think that getting a full-body scan once a year is a smart way to catch diseases early. It sounds like a great idea, but the reality is different. CT scans expose your body to radiation, and repeated exposure over time can increase the risk of cancer. On top of that, these scans often detect small abnormalities that may never cause any harm. This can lead to unnecessary follow-up tests, biopsies, and anxiety. So unless your doctor specifically recommends it based on symptoms or risk factors, routine full-body CT scans are not something you should be doing regularly. The second test is the PSA test for prostate cancer, especially when done routinely without symptoms. This test measures a protein in the blood that can be elevated for many reasons, not just cancer. In older men, PSA levels can naturally increase with age. The problem is that this test can lead to overdiagnosis, finding cancers that are so slow-growing they would never cause harm during a person's lifetime. Once detected, however, many people feel pressured to undergo treatments like surgery or radiation, which can have serious side effects such as urinary problems or sexual dysfunction. That's why it's important to have a detailed discussion with your doctor before deciding on this test. Next, let's talk about routine ECGs when there are no symptoms. An ECG, or electrocardiogram, is a test that checks your heart's electrical activity. It's a useful test when someone has symptoms like chest pain, shortness of breath, or palpitations. But doing it regularly, without any symptoms, doesn't necessarily prevent heart disease. In fact, it can sometimes show minor abnormalities that are not dangerous, but lead to more tests and stress. Instead of relying on routine ECGs, it's more effective to focus on controlling risk factors like blood pressure, cholesterol, diet, and physical activity. Another test that seniors often overdo is repeated vitamin testing, especially for vitamin D and vitamin B12. While these vitamins are important for your health, testing them too frequently is usually unnecessary unless there is a known deficiency or specific symptoms. Many people start testing these levels every few months, thinking it will help them stay healthier. But in most cases, once levels are stable, there's no need for frequent monitoring. Overtesting can lead to unnecessary supplements, and in some cases, taking too many supplements can even cause harm. The fifth test to be cautious about is frequent blood sugar testing in individuals whose diabetes is already well controlled. Monitoring blood sugar is essential for people with diabetes, but testing too often, especially when levels are stable, can cause unnecessary stress and anxiety. It can also create confusion when normal fluctuations are misinterpreted as problems. The key is balance. Follow your doctor's advice on how often to check your levels rather than doing it excessively. Now, you might be wondering, if these tests can be unnecessary, how do you know what's right for you? The answer lies in personalized care. Every person is different. Your health decisions should be based on your medical history, current health condition, lifestyle, and doctor's guidance. Just because a test is available doesn't mean it's needed. It's also important to understand the concept of overdiagnosis. This happens when a test detects a condition that would never have caused symptoms or harm. While it might seem like finding something early is always good, overdiagnosis can lead to treatments that are not needed. These treatments can have side effects, reduce quality of life, and create emotional stress. Another factor to consider is false positives. This is when a test result suggests there is a problem when there isn't. False positives can lead to a chain reaction of more tests, procedures, and worry. For seniors who may already be dealing with multiple health concerns, this added stress can have a significant impact on overall well-being. On the other hand, avoiding unnecessary tests doesn't mean ignoring your health. It means being smarter about it. Focus on regular checkups, a healthy diet, physical activity, good sleep, and managing existing conditions. These are the things that truly make a difference in the long run. Communication with your doctor is key. Always ask questions before getting a test done. Why is this test needed? What will the results change? Are there any risks involved? Are there alternative approaches? A good doctor will always be willing to explain and guide you. Let's also talk about the emotional side of testing. Many people feel reassured after getting tested, even if the test wasn't necessary. It gives a sense of control. But true peace of mind comes from understanding your health, not just testing it repeatedly. Educating yourself and making informed decisions is far more powerful. Family influence can also play a role. Sometimes children or relatives encourage seniors to get multiple tests done out of concern. While the intention is good, it's important to rely on medical advice rather than fear. More tests do not always mean better care. Another common misconception is that modern technology can catch everything early and prevent all diseases. While medical advancements have improved diagnosis and treatment, no test is perfect. Each has its limitations, and understanding those limitations is crucial. Preventive health is not about doing every possible test. It's about doing the right things at the right time. Vaccinations, blood pressure checks, cholesterol management, and cancer screenings recommended by your doctor are important. But beyond that, unnecessary testing should be avoided. Let's not forget the financial aspect. Medical tests can be expensive, and unnecessary testing can add a financial burden without providing real benefits. Being mindful of what you truly need can save money and reduce stress. At the end of the day, your health journey should be guided by knowledge, not fear. It's easy to get influenced by advertisements, social media, or even well-meaning advice from others. But the best decisions are made when you are informed and supported by a healthcare professional. So remember, just because a test exists doesn't mean you need it. Think carefully, ask questions, and focus on what truly matters for your health. Making smart choices today can lead to a healthier, more peaceful tomorrow. Thank you for watching, and take care of your health the smart way.